And welcome to Duke Spine Institute live stream spine surgery today, February 10th, 2026. Our patient travels here from remote areas of Florida on the West Coast. He's here because he's having horrific back pain. Now, I want to show you all something here. Take a look at this back, Henry.
We can see.
Oh, sitting on, please.
Pull the fluoro back. Folks, if I could bring my size 13 shoe up here and show you this incision. You all see this here?
Yes, we do.
This is the scar from his prior fusions. He's had 3 fusions now on his back. They fused the L2, L3, L4, L5, S1. He's had cages put in each time. 3 major surgeries, and here he is in horrific pain. And look at the swelling he's got here. This swelling is now at the top of his fusion, and guess what his spine surgeons told him? You need more fusion. He went and got several opinions, and they talked about fusing him up higher, all the way up into his thoracic. Folks, this is a disease of our society today. Spine surgeons recommending fusions and pain management and shots and more fusions and stimulators, and it goes on and on and on and on. And it's totally unnecessary. We can now fix all the back pain sources with tiny little cuts, 4 millimeters, that big. No big scars, no bone graft, no cadaver bone, no metal. Come on back in with that x-ray. I'm going to show you all the cages he has. He has so many different cages. Why? Because he's had so many different surgeries. And the surgeons told him, your spine is perfect. There's nothing wrong with it. It's beautiful work. All right, let's take a look at cage number 1. Go on south, where you were before. So the first cage is right there. Sean, you see that little mark right there? Yeah, there you go, up higher. There's the L4-5 cage. That's called a tantalum marker. Shows you where the cage is. He fused that level, 4-5. Then they went down and fused 5-1. There's a different cage. See the marks are different? Then they went up and fused 3-4 and 2-3. And you got 2 cages there that look the same. And then they put these weird, like zip tie coils or something in his back. And I think they're related to what's called a bone growth stimulator, probably to stimulate fusion. Look at all that bone out there. All that bone shouldn't be there. It's just growing off his spine. All this excess bone for the fusion. This is not normal, folks. What we do here at Duke Spine is completely natural. It's the natural way to get rid of back pain without putting metal, fusion, cadaver bone, hospitalization, all done outpatient. All right, Sean? And then he had a 9-hour surgery to remove all the screws and rods. Okay, we're going to get started here. We are going to be doing a DPR, bilateral T12-L1 shot, L1-L2. So I want to be just a smidgen higher, right about there. That should give me access to 12, 1, and 2. Yep, right there. A little bit of numbing medicine. Now, Henry, let's show the audience what adjacent segment disease looks like when it comes from a injured or arthritic facet joint. How do facet joints cause so much pain, like this patient's pain, and how do we fix it with our Duke plasma rhizotomy, a patented procedure that I developed years ago that is completely patented here at Duke Spine and not available anywhere else. The only permanent treatment for joint pain.
For more details, please visit our website at www.dukespine.com or call us at 1-800-FIX-MY-BACK, 349-6922. Facet joint injury is a common cause of chronic back pain. The inflamed facet tear generates pain signals. The best treatment for facet joint pain is the Deuk plasma rhizotomy. Inflamed facet joint pain nerves are destroyed. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
Welcome back. You can see from our animation how we treat facet joint pain at Deuk Spine with a permanent procedure to eliminate facet pain. It's called the Deuk plasma rhizotomy. Sean? And this patient has bad arthritis in the facet joints. You guys see that? Sean?
Yes, we do.
Show us the arthritis, Jordan. That's right. A lot of arthritis there in his facet. A lot of scar tissue here. Sean? Sean? I think I'm a little bit above the TP there. There we go. Sean? A little below. Sean? Any questions?
At this moment, no current questions.
Good. Done with one side. That's the patient's left. Now we'll move to the right. We've shown the audience what causes facet joint pain and how we treat it.
Correct.
At Deuk Spine with our permanent fix, the Deuk plasma rhizotomy. Unlike radiofrequency ablation, which is a temporary treatment, and if it doesn't, most of the time RFA doesn't work. They have to do tests like medial branch block, facet joint injection to verify that it's going to work. And then people get the RFA done, and unfortunately a lot of times it doesn't even work. All right. I want to make the next incision right about there, Shot. We're going to move on to the right side, which is his most painful side. Thank you, Luis. Good job. Any questions?
At this moment, no current questions.
Well, let's share with the audience the 30 different causes of back pain, shall we?
Of course.
I'm Dr. R. Deukmedjian with the Deuk Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Deuk laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5-S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5-S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5-S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Deuk plasma rhizotomy of the SI joints offered at Deuk Spine or Deuk Joint Institute. The fourth most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Deuk piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, such as the vertebral bodies, with trauma can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable